I really would love to share a little bit about our journey because it has been exactly a journey. Let me tell you a little bit about our department so you can kind of see a little bit about our scope. I don't know how many of you have ever been in food services, perhaps one of your first jobs or when you were trying to work your way through college. Food services can actually be a very hard environment, very hot environment. My dish machine wouldn't even fit in this room, it's that big. It is a very hot environment. We have lots of ovens. I have 6 ovens in my department. I have steam tables and hot boxes and steamers, and so there's a lot of hot going on and there's a lot of hard going on. We actually about 90% of our work shift, we're on our feet. We pound pavement for the majority of our shift. It is oftentimes very labor intensive, and if you really think about it, we're probably the least paid group of people in the entire building, but yet you can't have the hospital run unless we're running, which I find very fascinating actually.
All these numbers you're throwing out to us include all the various facilities, right?
No, this is just really at Presbyterian downtown.
Oh, really?
It was the heart of our lean project. Presbyterian downtown has really been the flagship for Presbyterian for many years and was the bulk of the amount of business that we do for Presbyterian as a whole. And so as lean came to our process improvement area, we actually literally begged for the opportunities to have a lean project. Because we felt we really worked really hard. So if you looked at some of the things that we do, we obviously feed the patients 3 times a day, plus nourishments, which is like an in-between meal snack for some folks. We have a cafeteria where we are open 16.5 hours a day, every single day, 365 glorious days a year. We also manage the physician lounge where our physicians are able to get a respite, nourishment, or even collaborate with their colleagues, and that's open 24 hours a day. And we do catering. We do catering for meetings just like this for anybody on campus, but we also provide catering services for any Presbyterian site here in town that would like us. And we actually are extremely busy and really very good. Our patient meal volume in 2008, which is the year we actually received our lean project, we did 466,000 meals just for patients, and we actually served 2.2 million meals just on that campus alone. And at that time we had 89 FTEs. So our goal for getting a lean project was we really wanted to work smarter and not harder, because we felt we worked really hard as it was. So I went and really looked at how many pieces of equipment we actually move every single day just on a tray. We do 19,000 pieces of equipment, and that's like forks and spoons and cups and bowls, not food. That's a whole nother thing. So we might actually put twice as much actually on a tray, or then after that remove it from the tray. So we do it a lot. And then our goals for the lean project was really to increase efficiency and accuracy in our tray line area. There's nothing worse than getting your tray and finding out that you have no silverware. So you cannot eat the food that you were brought. We also wanted to increase our patient satisfaction scores, and I was fortunate enough to receive some capital monies to redo our department. So I thought it might be smart if I was going to rip apart everything to put it back together in a lean fashion so that we would really improve what we did. In 2008, this was our value stream map when we first started, and that's about what I said. I was like, oh my God, I think I don't want to do this anymore. It really scared us because most of us didn't know anything about lean. It was really a 4-letter word for us because we didn't understand it. But when our team brought this out, it was like, wow, we really do need some help. So we really thought we were pretty fast and we were pretty busy. Actually, according to the national standard, we have a statistic that we keep track of, which is trays per minute. We actually beat that even then, so we thought we were pretty good. But then after lean came along, we actually saw that, wow, we had a lot of idle time. We weren't really as organized as we thought we were, and we kind of didn't have really hot food. This is actually what we call tray line. It's basically an assembly line where we put the trays together. And these were our work cells. We had 6 work cells. So again, we thought we were pretty fast and pretty efficient. And we would tweak it, and we thought we were making it better, but Lean actually showed us that we were really putting a very small Band-Aid on what was really a big problem. So our challenges really were that in 2008 when we began, we really wanted to improve our productivity. We were running about 82% on our productivity, which is really pretty low for Presbyterian standards.
How did you get to 82%?
We actually had a Premier, which is, I guess, a company that we deal with has a tool that we were able to use, and we would put how many hours that we worked and how many meals. That was our metric, obviously, for food service. And they would come out with a statistic, and it would say that we were 82% efficient, which back then wasn't really very efficient. And our goal was to move up to 95%. We also wanted to improve our temperature of our food by 5%. We wanted to improve patient satisfaction, and that's an ongoing goal always for us. We also learned in 2010 that we needed to prepare for the new hospital, Russ Medical Center. And then after that, even learned that room service was the going trend for healthcare food service. And it was kind of being suggested to me that I needed to get to that. And with our construction project, we wanted to become a lot more efficient, but there were a lot of things that I could not change. I was kind of stuck with many of the columns that were in our kitchen or our basic food area where we produce. The hood can't be moved. I'm in the basement. I can't change those kind of things. So I had to work around those type of things, but yet still needed to be able to function and feed patients and employees and visitors without a hitch. So how do we really accomplish this? You know, I would tell you that I work in a really great organization, and administration was just really receptive. I don't know how we were able to manage to get a Lean project, but we were really very excited. We believe that a hospital runs on its belly, and we actually were able to convince them that that was probably true. We were very blessed with a wonderful group of process excellence folks that helped us, and I don't even think it was the one black belt we received and the consultant. We had people from the group that just came and helped with all the full work analysis and all of the things that we were doing. So we had them coming and going. I used to think it was really because they just wanted to be fed, but they told me it was because they believed in the project. Our entire management team, I have 4 folks that work at Presbyterian in the Food and Nutrition Department, and we were committed to make this happen. And we really wanted to make sure that this was bottom-driven and not top-driven just by the management team. We wanted our hourly employees to really understand what we were doing and why it was important. For our type of employees, you know, they really don't have a lot of education, but they can work really hard in trying to connect and make them understand why is really, really very important. And so we had a mandatory Lean training for all of our team, right down to the basics of why and what Lean was, right down to a really great game that the Process Excellence group had us do, and that was this Lego game. They still talk about it today. They loved it. And then really communication. It was really key to our staff, especially when we really had staff there 20 hours a day. So it was hard to see everybody. Yes, ma'am.
Are your 4 staff members dietitians? Is that?
No, actually, our dietitians belong to our clinical nutrition department, and they're a little bit outside the scope. It was really the main crux of our cooks, our chefs, our diet aides. Those are the folks that would interact with patients. Our food service workers, like dishwashers and our cashiers, all of those coming together along with our supervisors and managers to really feel like we understood what this meant and how can we improve on it.
What do you mean when you say room service? I've certainly been in the patient rooms prior to 2010, and the food was brought to the room.
Mm-hmm. Well, let me tell you a little bit about room service, because that's where we went. It was really because the great work that Process Excellence shared with us, and really feeling like we understood what Lean meant, that we were able to not only transform our department right then, we were able to set up our kitchen and our processes so that we could offer what's called room service. Hospital room service is just like you would get at a hotel. You pick up the phone and you call when you want to.
Oh, okay.
Traditional food service is some crazy dictator like me says, you know what, you're gonna eat at 7:30, 11:30, and 4:30, and I'm either gonna give you a choice or I'm not. And that's what you're stuck with, and be happy with that, okay? That's what we wanted. Well, we didn't want to do that anymore. We wanted you to feel like you were able to order what you wanted, just like you did this morning, when you want, anytime between 7 a.m. and 7 p.m. And it is the fastest growing trend in healthcare food service. It actually does save you money. And so our goal was that, you know, they're going to make us do that, so we might as well get on the program and start with that. So we started room service at Press downtown in 2010, shortly after our main project, but we felt like we had so much knowledge that we knew how to do this. We could figure it out. And so we did it for half of our department, or half of the building for half of our patients. We learned and were able to then begin doing full room service at Russ Medical Center, starting the first day of operation. We then transitioned at Press Downtown to room service. In 2012, we flipped the entire rest of the building. We opened a new coffee shop in the lobby, and we expanded services in our cafeteria. Our sales have actually just jumped up because it really came down to really understanding how to set up our flow, understand how lean can help us add new business and make our business stronger and more efficient.
Yeah, it's much